I'm Kim. I'm going to examine your feet today. The first thing I'm going to do before I examine her feet, though, is to look over her labs, look at her history, look at her A1C, look at her trending blood sugar, see how they've been. In her history, I'd look for amputations. I would look and see if she's had ulcers in the past, any infections in the past of her feet. First of all, let me have your foot there. I'm going to just kind of do a general survey of the foot. Look on the top of the foot, see if there's any ulcerations, any sores, any calluses on the bottom of the foot, on the ball of the foot. Make sure there's no ulcers existing. I'm going to look at the toes, and when I look at the toes, I'm going to look for hammer toes, curved toes, any kind of deformity that might cause a callus, which if the callus is rubbed enough, it could form a blister and then form an ulcer. I'm also going to look in between the toes because I'm going to look for athlete's foot or any macerations, any kind of moisture. I'm going to look on the bottom of the foot, see if there's any inflammation. Anything like that could cause an infection, which in turn could cause an ulcer to form, a wound to form. Looking at the toenails to see if there's any ingrown toenails, any fungus, any thickness on the toes that would indicate the toenails that would indicate some fungus. All of that could lead to infection or inflammation, which could make them at high risk for wounds. I'm also going to check their pulses. I'm going to check her pulses. I'm going to check her dorsalis pedis. That's great. I'm going to check posterior tibial. They both should be moderate, 2 to 3 plus. If they weren't, if they were diminished, that could indicate that she had some peripheral vascular disease and some neuropathy. I'm going to check for her equinus. I'm going to bend her foot to 90 degrees. If she wasn't able to do that, that can mean that the top of her foot lands before the back of her foot unevenly, which could end up forming a callus and could eventually form a wound. I'm going to also test her muscle strength. So I'm going to have you push against my hand to check plantar flexion. And I'm going to have you pull your foot towards your body. And I'm going to push against it. That's great. Okay, good. That shows that she has normal dorsiflexion and normal plantar flexion. If she didn't, muscle strength also could indicate that she did have some neuropathy. I'm also going to check vibratory sense. So what I'm going to do first is let her feel this on her arm, let her know how it feels. Then I'm going to take her foot. I'm going to have you close your eyes. I'm going to place it on her toe. And I'm also going to place it on her top of her foot. What should happen is she should be able to feel that at the same amount of time that I feel it with my hand. If she stopped feeling it and I was still feeling it in my hand, that would indicate that there is some neuropathy present. To diagnose how far the neuropathy went up, I would take the tuning fork and go up her leg to see when she couldn't feel it any longer. After that, I'm going to check for some sensory feeling. And I'm going to use a monofilament to do that. I'll let her feel how it is on her hand first. And then I'm going to go on her toes, her instep, and her heel, and the top of her foot. And she would let me know if she was able to feel that. If she couldn't, then that would indicate neuropathy. I'm also going to do some sharp dull testing. I'm going to let that's sharp and that's dull. So we're going to do that on our toes. Sharp, dull, sharp, sharp, dull, sharp, dull, sharp, sharp, dull. If she couldn't feel that, that could also indicate that she had some neuropathy. After that, I'm going to check her reflexes. See your other foot? I'll check the reflex. Alright. Her reflexes should be brisk. If they were diminished, then that could indicate advanced neuropathy and peripheral neuropathy. She would need further testing on that. I would also check, let me have your foot there, I'm going to check for temperature on your foot. It should be warm on the top and the bottom. If it wasn't, if it was cool, then that could indicate that she had also some circulatory problems and some neuropathy. As far as the patient follow-up, I would probably have her follow up annually if she was low risk, meaning that she didn't have any neuropathy or very little, and she didn't have any deformities. If she was moderate risk, I would have her come in every 3 to 6 months. Moderate risk would mean that she had some neuropathy, but not a large amount, and that she didn't have any deformities, or she had small amount of deformities. If she was very high risk or high risk, which could mean that she either had advanced neuropathy, she already had some deformities starting, or have had deformities in the past, amputations, ulcers in the past, then I would definitely want to see her every 1 to 3 months. If she had something like Charcot foot, Charcot foot could also maybe cause her to have a chance to develop calluses, because Charcot foot, the foot is flatter. It could rub as she walked and cause calluses. Follow up as far as the patient checking her feet would be weekly. I would recommend weekly. When she did that, she would definitely need to do it in a well-lit room where she could get a good look of her whole foot. If she saw anything at all, any ingrown toenails that looked infected, any wounds started, any calluses, she would need to see me, to call the office and see me, because that way we can stop things from getting worse and maybe heal them up quicker. I would check her shoes and make sure there was no deformities in her shoe that would cause a callus or wound to form. I would also recommend that when the patient, before they put their shoes on, they need to take their hand, feel inside their shoe, and make sure there's no objects in there. If a patient has neuropathy, if there's something in there that doesn't belong, they might not be able to tell because they have decreased sensation. If patients follow what they're supposed to do, see the doctor as instructed, take their medications, control their blood sugars, they can stop or prevent complications from occurring.